Hello, Sarah. It's wonderful to have you on the show. I'm so pleased you had the time to answer some sleep health related questions today. To start off with, could you please give a brief introduction of who you are and what you do professionally?
Absolutely. Thank you so much for having me, Dasha, and the docbotic team. I am Dr. Sarah Silverman, and I am a behavioral sleep medicine specialist or a holistic sleep specialist. And I help folks improve their sleep naturally. Part of my role as a holistic sleep specialist is to help people learn how to improve their overall sleep quality without medication or without sleeping pills. So I often help folks get off of their sleeping pills, whether they're prescribed or over the counter sleep aids, and really teach them very specific skills that have been shown to be effective for managing insomnia like symptoms. So either difficulty falling asleep, staying asleep, waking up too early, or a combination of those. Also, non-restorative or poor quality sleep is something that I see a lot, as well as sleep worry or anxiety around sleep and not sleeping well. So I try to intervene from a non-medication perspective. And I currently have a private practice where I see folks one-on-one and help them improve their sleep. I also have a health consulting business where I help women optimize their sleep and circadian health. And I also use epigenetics testing to help them further optimize their overall wellness.
Amazing. Thank you so much for that introduction. It looks like I definitely came to the right place to ask some sleep related questions that actually came from Docbotic's Instagram followers, and a few came from your followers.
Yes,
So, without further ado, let's jump into what our Instagram followers have submitted. So,
let's do it.
cool. So, one question that I asked is what sleep related struggles people typically experience? And one of the answers that I got was stress and anxiety related to career that keeps people up at night. So, I guess my question there would be, what is the best way to combat anxious thoughts that creep in when you're trying to fall asleep? And is there a way to detach from these worries?
Yeah, it's a fantastic question because stress and anxiety is very closely tied to your overall sleep quality. And so, first, I want to say it is very normal to experience any stress around work, or really, I would say it could be things on your to do list or things that you have planned the next day that can keep you up at night. Very, very normal to have those thoughts that may interfere with being able to fall asleep or get back to sleep. So, oftentimes, what I see in folks when they get into bed at night, they put their head on their pillow and they start to have a lot of racing thoughts, or they have a very overactive brain. It's often a sign that they didn't give their brain a chance to sort through those worries or stressors during the day. So, what I typically recommend is trying to address those thoughts or worries or those daily stressors at some point earlier in the day. So, typically, I recommend at least 2, 3 hours before bedtime, because sometimes if you start to try to address those thoughts or worries too close to bedtime, that can really influence how long it might take you to fall asleep. You become very activating or mentally stimulating. And so you want to give yourself a buffer zone between when you are addressing those worries or trying to detach from some of those thoughts or worries and when you actually get into bed. So, one practice that I really like, I use myself, and I also recommend to my clients, is what's called a constructive worry exercise. And as the name suggests, it's actually scheduling a time to worry constructively. And it's very much like problem solving. So, this is a simple exercise that You can make your own. There's really no right or wrong way to do this, but it's essentially giving your brain a chance to sort through those thoughts or stressors that keep popping up at night when you get into bed. So the exercise, it's you can grab a scrap piece of paper and create two columns. And you actually set a timer for this exercise. You don't want it to be too long, 15, 20 minutes max. You don't have to take the full time, but you certainly can if you need to. And during those 15, 20 minutes, you actually want to write down all of those thoughts or worries that keep popping up. So on the left side of the column or left side of your piece of paper, you make a list. You jot down whatever's on your mind, whatever's, on your plate that day. And once you have a decent list, on the other side of the piece of paper or the right side of the column, you go through each of those thoughts or worries and you try to identify a next step to address each of those. Now, it doesn't have to be the final solution, but writing down the next step to address it, even if it's a very baby step, can really help teach your brain that you do have a little bit more control over some of those thoughts or things that keep popping up. And again, it gives your brain a chance to really sort through those thoughts or worries that are on your mind. So then once that 15, 20 minutes is up, fold the piece of paper over, put it to the side. If those same thoughts or worries start to pop up at nighttime or when you get into bed, that's when you remind yourself, I already took care of those worries for today, and I did so at a time when I was actually, thinking clearly and really wanting to address those worries. So it actually teaches your brain to compartmentalize those thoughts or worries, offload them during the day so that they're less likely to interfere with your sleep at night. So it's something that I recommend to do as a regular practice so that your brain learns to really disconnect the worry from your nighttime and, of course, your sleep.
Amazing. That's such a cool technique. I've never heard of it before, but it definitely makes sense for like restructuring your worries so that they're not one big clump and more, sorted out before you go to bed. Um, Another issue that came up is not fully resting, even though the person sleeps enough, like sleeps seemingly enough, 7 to 8 hours, but wakes up tired. So the questions I have related to that are what might cause not feeling rested after a night of seemingly sufficient sleep, and what makes sleep more restful?
Great questions. So it is something I see quite often. Sleeping 7 or 8 hours and still waking up feeling tired. And there are a couple different reasons for this. So, one could actually be that you may need more than 7 or 8 hours of sleep. So, your sleep may be interrupted or cut short because of work or school or responsibilities, right? That's the case for a lot of people. They're not able to have enough opportunity to sleep in order to get the number of hours that they actually need. Another reason could be what's called circadian misalignment. So, someone who maybe isn't sleeping in their biological or natural sleep window or sleep schedule, but they have to wake up for work or school, again, responsibilities. And there's a mismatch between their internal body clock, their natural circadian rhythm, and the time that they're actually waking up. So that can cause a feeling of tiredness in the morning. There's also the possibility of sleep debt. So insufficient sleep or not getting enough sleep, which could be caused by a number of different reasons. But I'd say the most common that I see is there's actually an underlying sleep disorder in the picture. And the most common that I see is typically obstructive sleep apnea, where that actually causes quite a bit of sleep deprivation. And over time, that can lead to waking up feeling pretty tired or even exhausted, even after getting a full 7 or 8 hours of sleep. So it isn't so much about the number of hours of sleep that you get when we're talking about waking up feeling tired or or exhausted. It's more so about the quality of the hours of sleep that you're getting. So your sleep quality is really going to dictate how you feel when you wake up.
Right. And you said that it depends on the person, how much you actually how many hours of sleep you actually need. So it's not like a one size fits all with 7 to 8 hours, right? Like someone might need
Correct.
more than that.
Correct. Yeah. I always tell my clients sleep is just like shoe size. One size does not fit all. Some people need more than 8 hours, some people need less than 8 hours. The recommendation for most adults is 7 to 9 hours. However, some people will fall on the lower range or the higher range. And so, sometimes it's a matter of not being able to get the number of hours of sleep that your body requires. And that, again, could be for a number of different reasons. But oftentimes, what I see is the quality of the hours of sleep that someone may be getting isn't high quality. And that can also lead to feeling tired in the morning. So, whether or not you need 8 hours of sleep, some people do, some people don't. But as I share with my clients, eight isn't a magic number. And sometimes trying to get 8 hours of sleep every night creates more worry or anxiety around sleep if that number isn't reached. So I always suggest first focusing on the quality of your sleep versus the actual quantity. The quantity will follow, and yes, it's important, but the quality is going to be much more important in terms of waking up feeling rested or refreshed.
Right. You also mentioned that people have individualized internal clocks. So when you fall, like the optimal time to fall asleep and the optimal time to wake up, regardless of the hours you sleep, will be different from person to person, right?
Correct, correct. And this is actually what's called your chronotype. So it's
Right.
your biological, your predisposition to when your body is naturally ready to fall asleep and naturally ready to wake up. So I would say most people fall into what's called a typical chronotype, which is like a 10 p.m. to 6 a.m. schedule, more or less. But then there are some people who identify as more of a morning chronotype. And then there are some who are evening chronotypes. And then there are some who are in between. They're, neither morning or evening. And so the minority of the population are going to be, very early chronotypes or very late chronotypes. Majority of people are going to fall in that typical sleep schedule. But it's something that I always tell my clients, it's important to know what your chronotype is, because if you can sleep in your natural biological window, you're actually going to get better sleep as a result, because your sleep wake circadian rhythm is aligned. And so it's circadian alignment, which is what I wish for everyone. But of course, we live in a world where a lot of folks can't sleep in their natural circadian window and align with their chronotypes for whatever reason. So can be challenging to manage, but it is possible to manage with a little help.
Right. That's really interesting because I know that many fellow students, I am a student myself, say that they're a night owl naturally. And they're like, it's like the majority of people claim to be a night owl, when in fact it's very likely not actually their chronotype. They're just kind of forcing themselves to be a night owl, and it's not really the optimal window of time for them to sleep at all. But
Yeah, and I'll just mention it's actually a very normal part of human development to experience a shift in your circadian rhythm starting about the teenage years and young adult years. So it's actually normal for young adults to feel like they are night owls, to feel like they have a later sleep schedule because there's a little shift in the timing of their circadian clock that happens. And then for most people, after those young adult years, they end up shifting back to a more typical sleep window. But there are some people who end up staying in that late or later sleep schedule.
interesting. Okay, so moving on to a specific question that I got on Instagram. How do I stop grinding my teeth at night? If I'm correct, that's called bruxism. So
Mhm.
the person's question is, how do I deal with bruxism or teeth grinding, and what could help?
Yeah, so with teeth grinding, there are typically two possible reasons for why that's happening. One, which is very common, it's stress related. So some people will grind their teeth or clench their teeth when they're under high periods of stress. And the second reason is potentially due to an underlying sleep disordered breathing issue, meaning that the airway is either partially blocked or blocked at some point during the night, causing some of that grinding. So, the way that I like to describe grinding or clenching or bruxism is it being on a spectrum where, on one end of the spectrum, you have that grinding or clenching. Then in the middle of the spectrum is also snoring. And then on the far end of the spectrum is going to be sleep apnea, where there's actually pauses in breathing during the night, which contributes to quite a bit of sleep deprivation. So, grinding or clenching is on the spectrum of sleep disordered breathing. And so typically that can mean, again, it could be stress related, but for many folks, typically there's something going on in terms of the airway, so how much oxygen you might be getting at night. And my best recommendation for grinding or clenching is to actually consider a sleep evaluation, so seeking out a sleep specialist to get a better picture of why someone is grinding or clenching their teeth at night.
Thank you. I think many people find it not obvious that teeth grinding is in some way related to obstruction of the airways. It's not a very obvious connection. So thank you for mentioning that it's important to check for issues related to sleep apnea.
Absolutely. Yeah, it's your airway health.
Great. So moving on to the next question from one of our followers. And the question is how to get sweet dreams and push off other thoughts that roam in mind. And I know you have already addressed the part about the anxious thoughts and how to sort them through using your method with the paper and the two columns, which is really cool. So I guess the other question that comes out of this one is how do you set yourself up for positive dreams and how do you tackle potential nightmares?
Yeah, so another thing that is incredibly common and can be caused by a number of different reasons, but the most common is typically stress. So, bad dreams or nightmares can often be stress related. They're also, of course, potentially related to a history of trauma, and that can take various forms. So, in terms of bad dreams or nightmares, what I typically recommend for my clients falls under the umbrella of what's called dream rescripting. And it's actually a way to teach your brain or like learn another skill, teach your brain how to rescript some of the not so great dreams that you may be having. So, this is great for bad dreams or nightmares if they're happening on a regular basis. And essentially, what dream rescripting is in a nutshell is to actually practice rehearsing a more positive dream that you would enjoy having during the night, but practicing what that would look like during the day. So it's also another little activity or exercise to do on a piece of paper. Grab a scrap piece of paper or a journal and actually write out a dream that you would enjoy. So script a dream that you would want to have at night. And it could really be about anything, something that you would enjoy, something that you would, like to envision while you're sleeping. And you write it out in as much detail as you can. You could also, I typically have my clients start out just writing positive imagery down. So places that they enjoy, for example, like the beach or going hiking in the mountains or forests, just writing down what they might see, hear, going through all the five senses, what they might experience when they're in their favorite place. So, starting with just writing or scripting out positive imagery. And then, once that becomes um, relatively easy, moving to rescripting a dream. And again, actually writing out how you would want your dreams to look and in as much detail as possible. And I always also recommend going through the five senses as a way to really help your brain um, envision the entire experience. It helps you kind of um, teach your brain what you actually want to be dreaming about. And so it's another thing to practice again during the daytime. And as that becomes a regular practice, a lot of folks will notice that their dreams start to change. The theme of their dreams can change. And if for some reason, say, that is practiced for a few months and the dreams aren't changing, then what's interesting is sometimes nightmares or bad dreams could actually be related to an underlying sleep disordered breathing issue.
Really?
So,
Wow.
grinding or clenching, so bruxism, can actually be related to nightmares as well as obstructive sleep apnea. They're often very much related. And what I often see is once my clients end up getting treated for the bruxism, for the grinding, for the sleep apnea, oftentimes their nightmares or bad dreams resolve. So that can be in the picture for a lot of folks and something to think about.
Wow, that's so interesting. So, physical sensations that you have during sleep impact what dreams you see.
Correct, because oftentimes the grinding, the sleep apnea, if that's in the picture, it tends to be more pervasive or it tends to happen more often during REM sleep or dream
Hmm.
sleep for most people. So there is a higher likelihood of experiencing more sleep disordered breathing during dream sleep. And as a result, that can cause um, vivid dreams, again, nightmares, bad dreams. And so they're very much related. And that isn't necessarily the case for everybody. Sometimes nightmares are very much stress or trauma related, but more often than not, I would say it often is something related to airway health and the way that you might be breathing during the night.
Oh, that's really good to know because people wouldn't think to check their breathing during sleep when they're looking for the cause of their nightmares. Actually, one more thing I wanted to ask about dream rescripting is, so if you're getting a recurring nightmare, would you write it out and then change what's happening in the nightmare to something positive to rescript it, or would you write a positive dream that you'd like to have from scratch?
Fantastic question. And what I typically recommend is to write out a positive dream that you would like to have because sometimes the nightmares are really scary or terrifying. And a lot of my clients don't want to bring up those specific details.
Hmm.
They can cause a lot of distress or more worry or anxiety during the day if you're actually writing out what you're experiencing, almost like rehashing the event. And so, what I really like about dream rescripting is you don't have to actually envision the dreams that you're having. You can simply start with envisioning the positive dream or experience that you want during the night. So, of course, everyone's a little bit different, but I'd say for most people, you do not have to address the specific details of the nightmare in order for the practice to be successful.
Great. Okay, that makes sense. Um, so moving on to the kind of next section of questions, and these questions came out of an Instagram poll that docbotic set up, and it was on the topic of alarms and waking up. So we asked people how effective alarms are for them and how many alarms people typically need to wake up. And the poll data suggested that over a third of our responders need multiple alarms to wake up, and out of those people, over half need over 4 alarms to wake up, which I
Yeah.
definitely relate to a lot. I personally need 4 alarms to wake up, and it still sometimes doesn't work. So my question on the basis of that data is what determines whether someone finds it difficult to wake up with an alarm? And is it normal to need so many alarms?
It is not normal to need multiple alarms or to be snoozing multiple times. And the short answer to your first question there is it's all about your sleep quality. Your sleep quality is really going to determine whether or not it is difficult to wake up with an alarm. And for most people, I would say, because of work and school and family, maybe kids, other, day to day responsibilities, using an alarm is necessary in order to have enough time to get up, get ready, and go about your day. But oftentimes, the alarm is set much earlier than the internal body clock really wants or needs. So it's almost like interrupting a normal sleep wake cycle. So for a lot of folks, they're not really able to complete, say, a full night of sleep because they have to get up early for school or work. So that can definitely make a difference. And I know it's sometimes easier said than done. Not being able to use an alarm, I think, is what a lot of people look forward to when they end up retiring, not needing to get up or have to set an alarm. But that can certainly influence how you feel when you wake up. And I know this is also something that's easier said than done, but setting your alarm for the latest possible time that you need to be up for the day so that you don't end up snoozing is, I would say, the best solution there. So to really try to prevent snoozing, set it for that latest possible time that you need to get up and out of bed and start your day. Because any amount of sleep that you get in between those snoozes, for a lot of people, it's like 6 minutes, 9 minutes.
Hmm.
It's going to be very poor quality sleep,
Right.
and it's not going to feel restful or restorative. And it has actually been shown to cause even more grogginess or fatigue in a lot of people. So you'll actually end up feeling better by setting that alarm the latest time possible instead of snoozing multiple times.
Right. Right. So it's better to wake up at an earlier time than snooze or wake up at a later time. But snoozing is like the worst option here. Like you need to actually make the
Snoozing,
commitment
yeah.
and wake up with an alarm whenever you have
Yeah,
it.
and again, this is something that for a lot of people, it can be really hard to prevent snoozing. And that is often a sign that maybe someone isn't getting enough sleep. They're sleep deprived, they're experiencing sleep debt, and their brain wants more sleep. So it's just really difficult to wake up even with an alarm. And then, on top of that, just depending on the overall quality of that night of sleep, that can also dictate whether or not someone snoozes. So, for example, if someone is waking up multiple times during the night, their sleep is very interrupted, there's a higher likelihood that they may find it difficult to wake up and have to snooze in the morning. So there's so many different factors that play into that. But at the same time, it is ideal to wake up at the same time every day to regulate your circadian rhythm. So that's also something to keep in mind when thinking about setting an alarm.
Right. Um, Makes sense. So you said that it's better to wake up at the same time every day, but you know how people typically will sleep in on the weekends and then they're back to work on Monday and they wake up earlier. Is that kind of disruptive to a sleep schedule? And is it valid to try to cover sleep debt on the weekend, like you've been undersleeping for 5 days and then you sleep a lot for two and you balance it out, or does it not work like that?
Unfortunately, it doesn't work like that. Um, we as humans cannot really catch up on sleep, especially if there's been a long period of time where someone isn't getting enough sleep. And in general, waking up at the same time every single day, including non work days, non school days, and on the weekends, is ideal for regulating your circadian rhythm. In terms of trying to catch up on sleep on the weekends or sleep in on the weekends, that could actually do your body a disservice. And I say that because your internal body clock doesn't know the difference between Monday through Friday and then the weekends. It just knows that it needs to be on a 24-hour timing to match your environment. And by the way, the circadian rhythm or your internal body clock is regulated by light, by natural light, and then darkness. So your internal clock doesn't know what day it is. And for that reason, it is really important to try to stick with the same wake up time, ideally 7 days a week. And what I see end up happening for a lot of folks is, they will sleep in on the weekends. That throws their body clock off. And this isn't a diagnosis, but it's actually now coined social jet lag. So it's almost like flying across multiple time zones. And then you try to adjust your body back by Monday morning. And that can be really hard to do. I mean, even a couple hours can make a huge difference. It takes your body some time to adjust back. So it's essentially like causing a bit of jet lag within the body. And then your body clock tries to readjust once you get back on your weekday schedule. And over time, that can cause a bit of sleep disruption or contribute to poor sleep quality.
Right. So it doesn't cover sleep debt actually creates a vicious cycle where you throw yourself off on the weekend thinking you're catching up on sleep, then you're disrupted for the next 5 days and you sleep poorly and then you need to catch up again and then the cycle goes on.
It's a vicious cycle, as you said. Yeah, that's a great way
Right.
to put it. And I will just say, for some people, this I see more in teens and young adults who are maybe pulling all nighters to study or they're up really late for social events. There is a bit of an attempt to make up for sleep on a very short term basis. So, instead of the brain being able to make up for weeks and weeks of lost sleep, the way that the brain attempts to make up for those very acute periods of sleep deprivation is it actually ends up um, letting you spend more time in the restorative stages of sleep.
Mhm.
So, after, say, you pull an all nighter, you're up studying late, that next night, you are more likely to spend more time in deep sleep or slow wave sleep and REM sleep. So, there is a little bit of catch up or recovery sleep, again, for very acute or short term periods of sleep deprivation. But as far as more of that chronic long term sleep debt, it's virtually impossible to make up for that lost sleep.
Right. Makes sense. Thank you, Sarah. So, the next poll we did on Instagram was about sleep medication, which ties neatly into us talking about all-nighters and vicious cycles of thinking you have sleep debt. So, the questions we asked were, do you use sleep meds? And does your use of sleep medication concern you? So the data that we got suggested that around a quarter of our responders use sleep medication, and around a third of sleep medication users are concerned and want to stop using sleep meds. So the questions coming out of this data is is sleep medication a healthy way to tackle sleep disturbance in general? And how often and in what scenarios is it appropriate to use sleep medication?
Mhm. Sleep medication, in my opinion, is a tool that can be helpful on a short term basis to consolidate or stabilize sleep. So, to help get more consistent sleep on a short period of time. So, sleep medication, I don't think of as good nor bad. I think of it as a tool. And just like any tool, there is an appropriate time to use it versus maybe when it isn't the best time. And so this is really going to vary on an individual basis, but they can definitely be helpful for a lot of people. Again, to help stabilize sleep or to get sleep a bit more consistent. And then, from my perspective, of course, I'm biased as a holistic sleep specialist. In the long term, I think it's a lot more healthy to be able to learn skills that are going to allow you to sleep naturally. So, on the one hand, they can be helpful on a short term basis. On the other hand, I would say on a long term basis, learning how to sleep without medication, learning how to sleep naturally is really going to provide the best solution for the rest of your life. So it depends on the person. And the approach that I typically take when it comes to helping people get off of their sleep medication is called cognitive behavior therapy for insomnia, or CBTI, which SleepBot is also a CBTI sleep improvement program. So it's very similar along the same lines. The idea is to really teach people skills that have been shown to be effective for managing insomnia and for sleeping well, with the goal of potentially, if it's the person's goal, come off of their sleeping pills or sleep aids at some point in the future. So it's learning skills to help build up some confidence in sleeping well, and then addressing the medication after there are some other tools in your sleep toolkit, as I like to call it.
Right. So would you say you should transition slowly? If, for example, if you are dependent on using sleep meds often, would you transition slowly from sleep meds to using skills that you have learned in CBTI, for example, and like slowly wean off as you get more confident in using the newly learned skills?
Yes, I always say proceed with caution and speak with your doctor, of course. So, whomever is prescribing, or even if it's over the counter, I always say speak with your doctor to come up with a realistic step by step plan, because everyone, in terms of what they're taking for sleep, it impacts their sleep quality in different ways. So always speak with your doctor to come up with a plan, what makes the most sense based on what you're taking. But oftentimes, I work with folks who are taking sleep medication or sleeping pills, and they start CBTI. So they, are doing both at the same time. And then as they start to build up some of the confidence in their natural sleep ability, then we slowly work with their prescribing doctor or healthcare provider to come off of the medication. So that often is kind of a last step in the process for a lot of people. And I think it is really important to first build up some confidence in sleeping, and then very slowly, very cautiously work with your doctor to taper the medication.
Right. So I guess one of the takeaways here is don't quit cold turkey. Don't just on one day decide I'm not going to take it anymore. From now on, I build my confidence. It's very much like an overlap where you're still taking medication and working on your skills.
Exactly,
Yes.
exactly. With cold turkey, I have worked with a lot of people who will do that because they're just, they're tired of taking something for sleep, or they've been taking a sleeping pill for a while and they're still not sleeping well, even while taking something to sleep. So going cold turkey can increase the risk of experiencing what's called rebound insomnia, which is essentially having worse sleep as a result of trying to taper or discontinue the medication. So it causes this rebound effect where, for a lot of people, that looks like it taking a lot longer to fall asleep. So they'll struggle to fall asleep, or they actually have a reduced total sleep time as a result. So sleep can get worse. Usually it lasts a couple nights, but sleep can get worse when someone is in the process of rebound insomnia. Again, typically that happens when someone goes completely cold turkey from their sleep medication. So, no, it is not something that I recommend.
No, you wouldn't be one to creating even more sleep anxiety. And if you quit cold turkey and you see that it's gotten even worse, you think, okay, well, I have no skills whatsoever. I will never get out of this. When it's not true, you just should have approached it with a different strategy, really.
Yes, yes, it can be more anxiety provoking, that's for sure.
So, next, I wanted to bring up something that several Sleepbot users actually said in surveys that we have sent out. And an issue that comes up for many people is being sleepy during the day, which causes taking disruptively long naps. Um, and then the kind of vicious cycle continues that you're sleepy, you take a nap during the night, you have worse sleep, so then you're tired, and then you nap, and the cycle goes on. So I wanted to ask if you have any recommendations for people who want to break this vicious cycle, stop napping disruptively, and regulate back to sleeping at night.
Mm. So with naps, it is another thing. There isn't a one size fits all, and it really depends on the individual. What I want to make really clear is that sometimes during the day, having some sleepiness, so actually being able to nap or doze off on a regular basis, can be a sign of an underlying sleep issue like sleep apnea, or again, that bruxism, that grinding or clenching. So, on the spectrum of sleep disordered breathing, or someone isn't getting enough sleep, they're sleep deprived. That typically can cause a bit of sleepiness during the day. And so, for that reason, I always say if someone is a regular napper, if they haven't already been evaluated by a sleep specialist, that I would say is the first place to start. Why is someone sleepy during the day? Now, in terms of naps, again, everybody is different. Some people are great nappers. They can take a power nap and it doesn't impact their sleep at night. But if someone is really struggling to fall asleep or stay asleep at night, then naps are not going to be indicated or appropriate during the daytime. So, with naps, the general rule of thumb is if you are wanting to take a nap or you're feeling sleepy and the nap doesn't interfere with your nighttime sleep, usually about 20 minutes, 30 minutes max is the sweet spot for most people, and typically before 2 to 3 in the afternoon. So
Hmm.
I always recommend, if naps work for you, set an alarm so that they aren't too long, and also ensure that they don't interfere with your nighttime sleep. If they
Right.
do, if they do end up interfering with your nighttime sleep, then I would say try to limit the naps so that you can really conserve your sleep for your nighttime. And so there are, again, a number of different reasons for feeling sleepy during the day. It's something that I would definitely recommend getting evaluated, getting looked at. But naps are also something that can be refreshing for some people. So again, it depends on the person. As long as it doesn't interfere with your nighttime sleep, then I say, naps are usually okay.
Right. Makes sense. So if somebody finds their naps disruptive, the first line of action would be to find the actual reason, evaluate why you need to take naps if they disrupt your sleep. And then you might find that there's an underlying health condition, either obstructed breathing, or it might be chronic fatigue, or it might be something else. And that's
Exactly.
important to figure out. Um, so, one of the questions that you actually got on your Instagram, uh, that I wanted to ask is, your thoughts on sleep trackers, because people are unsure if they're useful, if they should invest into a sleep tracker, and if like what they can help with.
Yeah. So sleep trackers can be a helpful tool for sleep. But it's another area where I think it depends on the individual. So some people love to track their sleep. They love to look at the data. They love to see, what's happening. And if it works for them, that's great. But say in the population of folks that I usually see where they're really struggling to fall asleep or stay asleep, they are usually dealing with insomnia, tracking sleep or using sleep wearables like the Fitbit or Ring, Apple Watch, there's so many these days. They can increase worry or anxiety around not sleeping well. And I do see a lot of the clients that I work with, they tend to fixate on the data. They tend to really look towards the tracker in terms of how well they've slept. So instead of actually kind of tuning into what their body's feeling or, how they're feeling during the day, they might look at the data in the morning and say, oh my gosh, my tracker said I was awake for 2 hours. Today's going to be terrible. So kind of using that data as a way to essentially dictate what ends up happening during the day. So again, it depends on the person. If it's something that you enjoy and it works for you, keep it. If it's something that causes a bit more worry or anxiety, what I usually tell my clients is use the trackers for everything else, but not for sleep, at least on a temporary basis until sleep improves, until sleep anxiety improves, and then you can reintroduce it back in.
Makes sense. Right.
I'll also just add one more thing to
Yeah,
that as well.
of course.
When it comes to sleep trackers, the accuracy of the data is also something to consider when compared to the gold standard in-lab sleep study. These sleep trackers or wearables, they just aren't as accurate yet. I think that there will be a day when they are very accurate, more accurate, and very sophisticated. But right now, in terms of how accurate they are, it's going to vary depending on what device you're using. But generally, they are not really great at predicting your individual stages of sleep. So as far as sleep staging, like light sleep, deep sleep, REM sleep, being awake, I say take that with a grain of salt. What they are pretty good at is estimating your average total sleep time. So on average, how much you're sleeping, and they're good for really tracking trends or patterns over time. But as far as the day-to-day and those very specific details in terms of sleep staging, they aren't as accurate right now.
Right. So it's not worth waking up, looking at your tracker, and feeling terrible about a disturbance that happened on one night and thinking that now you're going to have an unproductive day because your tracker says so. It may not be accurate, and also it's a vicious cycle to stress over what your sleep tracker says that you sleep worse, and your sleep tracker says that you sleep worse.
Yeah. Exactly. And I think it's important to note that waking up during the night is actually a normal part of the process of sleep. So most people don't realize this, but the average adult wakes up anywhere between 5 to 15 times every single night. So it's a lot, but they're usually very brief wake ups.
Mhm.
So you wake up, fall right back asleep. Most people don't have memory of those short wake ups, but they are happening. And so waking up isn't something to fear. It is a normal part of how your brain cycles through the different sleep stages at night. It's when the time awake during the night becomes prolonged, or you're awake for, say, an hour or 2 hours. That then typically falls into more insomnia territory for a lot of folks. So it's okay to be awake for a little bit as long as you're able to fall back asleep quickly. And sometimes those sleep trackers will overestimate how long someone has actually been awake, just depending on the stage of sleep. REM sleep, for example, is a very active stage of sleep. You can be very restless during REM sleep while you're dreaming, and the tracker might think that you're awake during that time, that you could have been sleeping in REM. So it truly depends, of course, on the person, but they're just not yet there in terms of accuracy. And in terms of wakefulness. So again, it's okay to wake up during the night, and as long as you can fall back asleep quickly.
Right. And for people who find that they fully wake up, become alert in the middle of the night and they cannot fall back asleep, do you have any specific advice for those situations?
Yeah, so one of my favorite behavioral techniques, so it actually falls under the umbrella of cognitive behavior therapy for insomnia. It's called stimulus control, and it is the practice of getting out of bed whenever you're not sleeping or whenever you know that you're not going to fall back asleep anytime soon. So, for example, like when someone wakes up, typically between the hours of, say, 2 to 4 a.m., um, there is often this idea that one, we shouldn't be waking up at that time, and that could actually be a normal time to wake up for most people. When that time becomes extended, or maybe you start to think about things or worry about things, that can make it challenging to get back to sleep. As soon as you start to feel frustrated about being awake, stressed, anxious, worried, that's actually when you want to practice stimulus control, meaning you want to physically get up and out of bed, ideally go into another room and do something that you would actually look forward to doing, something that is enjoyable to pass the time. And so you want it to be something that you would look forward to doing, as well as something that's relaxing or calming for you. And the goal isn't to get up and do that activity to try to get back to sleep. The goal is to simply just pass the time and do something enjoyable and to almost distract you from being awake. And when you start to feel sleepy again, so sleepy as in you can fall back asleep quickly, that's when you return to bed. So sometimes that practice is done a couple times a night for some folks. But the more that that does get practice, the more that the brain actually learns that your bed is truly just a place for sleep. You want your bed to really only be a place for sleep, and everything else that's considered a wakeful activity or something that you would do when you're awake that includes worrying or thinking about things, you ideally want to remove that from your bed and your bedroom so that you really strengthen what I like to call your bed sleep connection. So, removing any of that outside of the bedroom is ideal, but sometimes it also takes a little bit of getting creative, like for people who maybe can't go to another room or they have a roommate or they maybe live in a college dorm and they can't go elsewhere. As long as you are physically removing yourself from your bed, I think that's key. So going to another chair in the bedroom or creating a comfy corner in the bedroom that you can go to, just to really make it clear for your brain that your bed is for sleep only, and when you're awake you're outside of bed.
Right. So it's important not to associate your bed with being anxious and awake. It's important not to sit in bed and worry about falling back asleep and scrolling your phone, right? That makes
Yeah,
sense.
that often is something that will extend the time that you might be awake and actually interfere with being able to fall back asleep quickly. So this technique is, I would say, somewhat counterintuitive. It's the opposite of what most people want, right? They want more
Mhm.
sleep, so they'll stay in bed hoping to get more sleep, but that often means that they're staying awake or spending more time awake in bed. And you're absolutely right. Over time, the brain starts to blur sleep and wake together. So it becomes this cue for being awake or being stressed or anxious in the bedroom. And, the best approach that we know is getting up and out of bed, just really making it clear so that your brain learns a new association for your bed. And that is, one of sleep.
Right. And I suppose during the day as well, it's important to not say study in bed. I have seen quite a few people do that. They're doing some reading for lectures in bed, they're typing an essay in bed, and that creates the wrong connection in your brain that interferes when you're actually trying to fall asleep.
It absolutely can, and that is really common amongst students to be studying or, as you said, like working on projects or papers in bed. And yeah, it can create that blurry boundary between sleep and wake and potentially make it more challenging to fall asleep at night.
100%. Thank you, Sarah. Thank you for all the interesting information that we have learned today, and thank you for answering the questions that came up on Docbotic's Instagram and on your Instagram. I hope that some people who asked these questions can watch this and find something useful that they can apply to their own life and potentially head in the right direction for solving the sleep issues they're currently having. It was amazing chatting to you. Thank you so much, and I hope that at some point we can see you back on the show.
Yes, I would love to be back. Thank you so much for having me, and we'll talk soon. Have a great rest of your day.